Hey there, it's Dr. Jim. Thanks for stopping by. I'm just having some David Bowie coffee here. Actually, it's a Hawaiian blend in my David Bowie mug. And I must say, as I do in almost all my videos, everything tastes better in a David Bowie mug. So go get one. Okay. That's not what you came for, but what you did come for is something that I've been researching and writing about and studying for decades. Okay. Person-centered care. But I look at every angle of person-centered care. I try to look at every subtopic, minute, detailed person-centered dementia care, person-centered care in rehab, patient person-centered care in the community, therapy and pharmacology and all of these different types of things. Person-centered care in skilled nursing homes and in assisted living, and the person-centered way of dying, death and dying. So I take that concept and I apply it to a lot of different areas and arenas, if you will. My topic today is a good one. I write about it, and of course I'm sharing it with you now on this video, but it's person-centered care and severe mental illness. Individuals who have severe bipolar disorder, various types of psychoses, schizophrenia, and the various forms of schizophrenia, so on and so forth, levels of severity and everything else. Can person-centered care work with individuals who have severe forms of mental illness? That's my question that led me to a lot of research, digging in peer-reviewed articles, medical articles, psychiatric, psychological, gerontological, geriatric, you name it. And of course, what do you think my answer is going to be? It's going to be yes, of course. Person-centered care is all about working with the individual, finding out who they really are, what they value, what they want, what is important to them, what every day should be like for them, could be like for them, not telling them what and where and how to do everything, making them a partner in the care decision. They're in the center of the care circle, if you will. So, thanks for watching the video. If you do want to download or share the article, please do with your colleagues. So, at the heart of the care philosophy known as person-centered care is the person who's receiving the care, the treatment, the services, whatever. Counseling, mental health, behavioral health, pharmacological treatments. The individual is seen as the most important element in the process and should be considered a partner in care who will make decisions and choices about what he or she wishes and desires. Okay? Person-centered care involves treating the person with respect and dignity, individuality, and is sensitive concerning things like culture, religion, spirituality, gender, and so on. So, I ask, can this approach work for people who are diagnosed with severe forms of mental illness, like bipolar disorder, psychosis, and schizophrenia? And there are various group homes around the United States where individuals might live that fit this bill. There are seniors living in skilled nursing centers, and that's not why they're there, because that would be an inappropriate placement. But the mental illness is secondary to their physical illnesses or their dementia, which gave them the appropriate diagnoses to be to gain admission into a long-term care facility. Okay, so how person-centered care helps people with mental illness? How does that work? When used as a value-based approach or a philosophy, person-centered care humanizes the individual and looks way past his or her diagnosis. It encourages staff to see the person as a capable agent who can participate in his or her own care and make decisions that will improve one's quality of life. Staff learn to be more flexible with their roles and their daily tasks. They communicate with the individual and maintain a warm, loving, home-like therapeutic environment. In these ways, and in a lot of other ways, the individual feels more in control, which they should, of his or her life. Now, I'm going to list some important elements that you could use and apply to your client-centered, person-centered, patient-centered care, especially if they have moderate to more severe forms of mental illness. Number one, real person-centered care is proactive, not reactive. How can that be? Because staff are taking a proactive and engaging approach with the people that they are providing care for. In so doing, they spend less time reacting to what I would call an acute crisis or situation or a psychiatric emergency. They spend more time chatting with, spending time collaborating, being cooperative, flexible, and supportive in the care, but in the relationship. Person-centered care is proactive. Okay? Number two, you see the person, not the illness. Now, why is that even a thing? Because in Western nations like the United States, classic med school and medical training focused more on disease, illness, not the whole person. You know, holistic care has only been around for X amount of decades in the United States. Person-centered care has only been around for a while as well, even though client-centered therapy and care go back to Carl Rogers in the 1960s. I know that, but it takes time to spread around. So I don't see the schizophrenic or the person with bipolar or the person who's demented or the person with Alzheimer's. Oh, I see the person with chronic borderline personality disorder, or I see the eating disorder. I don't see those things. I see the person as a human with a body and a spirit and a soul and a mind and desires and who can be loved and who can be a part of the life of this place, wherever we might be. Number three, shared decision making. If you really believe in person-centered care, you don't walk up to the person with your chart. Okay, we're going to do this and we're going to do that, and this is what you're going to eat, and so on and so forth. And we're going to pass your meds at this time, and we're going to wake you up at that time, and so on and so forth. And I'm getting so overly animated that I'm throwing documents all over my office. It's not like that whatsoever. We're going to make decisions together. When do you like to get up in the morning? When do you like to go to bed? When do you like to get your medications? And do you know about all of your medications? And are you aware of what they're all for? And are you concerned about any side effects or whatever the case might be? But shared decisions mean relationships. Relationships are enhanced and valued between caregivers and care recipients. And decisions about the most mundane thing, of course, very important things, but very mundane. Your daily routine, your daily care, daily treatment, medication, so on and so forth. And of course, when we need to leave for appointments and go to clinics and hospitals and, specialty centers and whatnot, we need to make these decisions together. And then, of course, the fourth point that I want to make, and another important element of person-centered care, undoubtedly, the right leadership. The right leadership, supervision management, and the right staff. Why? Person-centered care is a philosophy, and a philosophy trickles down like rain on everyone working in a care space. And that leader lives, breathes, and models person-centered care. And the leader has to care about this in order for it to work. Person-centered care is only as good as your leadership and the staff who are living it, period. Another important person-centered point is the customization of care. Years ago, we used to call that individualization of the care plan, or an individual care plan, or whatever the case is. And I think what we were really trying to say 30 years ago, 20 years ago, person-centered care, but let's individualize the care plan. Everybody has a different care plan. It can't be cookie cutter for every patient and every resident out there. So yes, we look at the person's capabilities, we look at their strengths, what they might need help with. We identify the internal resources that that person has. And if we're going to customize care, then we want to maximize all of these things. And then the last one that I want to talk about, because I am so talky and I'm talkative and chatty today. I'm sorry if it's driving you, Conversations over tasks. Not talking to, not talking with. More than just, hey, what'd you have for lunch yesterday? Oh, that's great. Let me go pass my meds now. Nope. Full-blown conversation about movies, life, politics if you want to, but be careful with that one. Holidays, religions, and spirituality, and what's in the news, and what's trending, and what's going on around the world or in your town, or whatever the case is. You have conversations like you're having a conversation with just about anybody, of course, appropriate and within, ethical boundaries and whatnot, over the task. You're going to get the job done. They should be dressed, the bed should be made, and meals should be served, and meds should be passed, and activities and hobbies and the life of living space should be lived. Yes, but conversations, because what do you learn during conversations? You learn about the person, about their likes, their dislikes, their desires, what's valuable to them, what they expect, what they would like. All the important things from that person is discovered, not through a med pass, but through conversations. And guess what? You're going to end up with a lot of positive outcomes for the company, your organization, your building, your neighborhood, your unit, your floor, whatever we're talking about here. The organization itself, the structure itself, the people you take care of, your care recipients, they're going to feel more loved and included, and their quality of life is going to be better. And your employees, they're going to feel like, oh, this is finally the kind of care I've always wanted to deliver. It's so funny, as I go out and train healthcare facilities in person and around and online like this around the country, and sometimes in other countries, which is really cool. I talk about all of these important things. And I tell the direct care staff, don't be afraid to do this and that and everything else. I've talked with your management and your supervisors, and they're all about it, okay? They're on board. And I hear the direct care staff say time and time again, this is the type of care I've always wanted to provide. And I hear people who've been in long-term care for 20, 30 years say, I don't care what management says, I've been doing it like this for a long time. So both are good. I'm Dr. Jim. That's all I got. Keep coming back for more. I'm just one of those people. I'm a Capricorn, so I'm always climbing the mountain. Never getting to the top, by the way. I don't want to get to the top. I'm the person that I'm enjoying the voyage. I don't need to get to my destination quite yet. Keep coming back for more information. Thank you. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support, and partnering, please look for the link to the website in the description. You'll love what you see.